Good afternoon. My name is Elizabeth Rosser and I'm Professor of Emeritus at Bournemouth University. And the title of my presentation is Investing in Nursing Leadership, Looking Back and Moving Forward. And it's my absolute pleasure to be with you this afternoon. International Nurses Day. Well, it always amazes me to identify that nurses right across the globe are celebrating this very day in their own way, just as we are today. What is International Nurses Day but the birth of Florence Nightingale, celebrating her birth and the legacy that she leaves behind. That is the first school of nursing and the foundation of nursing as we know it today. The theme of this year's International Nurses Day is set by the International Council of Nurses, and it is, I quote, Nurses, a voice to lead, investing in nursing and respecting rights to secure global health. So a little bit about the background. The World Health Organization published a report on the first state of the world's nursing and identified the criticality of the nursing workforce to achieving global health. A subsequent publication identified also that investing in nursing leadership is a key priority agenda for achieving global health, and set 4 policy-focused areas of education, jobs, leadership and service delivery, really drawing on the outcomes of the State of the World's Nursing Report. So it's with this background in mind that I set the aim and objectives for this presentation. My aim is to examine how and who should be investing in nursing and identify any progress that has been made, and the objectives to identify what we mean by investment, whose responsibility is it to invest, to explore the requirements for strategic leadership in nursing, to reflect very briefly on the last 50 years, my own career of 50 years, and to see how the nursing profession has moved forward quite considerably, to reinforce the need to invest in the nursing workforce. And lastly, to identify the challenges to investment into making these investments a priority. So what do we mean by investment? Investment means strengthening the profession, not just financially, but emotionally, practically, and I think politically too, to support them in their role of keeping the world healthy. In the State of the World's Nursing Report, the then President of the International Council of Nursing, Annette Kennedy, stated, investing in nursing does make a difference. And I quote, every penny invested in nursing raises the well-being of people and families in tangible ways. Whose responsibility is it to invest? Well, the World Health Organization charged governments in this report to invest in education, leadership, and the practice context, recognizing that they have a responsibility as regulators and employers, firstly, to strategically coordinate, plan, fund the recruitment for a sustainable nursing workforce and its infrastructure. And secondly, to decide on their remuneration and rewards. But they're not the only ones who are charged with responsibility. I believe health and care organisations also have responsibility. There's plenty of evidence of inequities, lack of flexible working, poor pay, and a lack of compassionate leadership in the health systems. And therefore, it behoves health and care organisations to invest in the nursing workforce to enable retention, which is a real problem currently. Nurses themselves also have responsibility to invest in their own education, in their own skills development, to create clinical innovations, and to use their collective voice through nursing associations. But I also feel that nurses individually should actively seek out opportunity to have their voice heard. and then the society. During the pandemic, frontline nurses were very visible on social media, on the media per se, and society certainly valued their work. So I wonder, do they also have a responsibility to respond and contribute to nurses' sustainability? So in essence, investment is everybody's business. So the need to invest in strategic nursing leadership. What is or who is a strategic nurse leader? Someone certainly who looks to the future and has a clear vision and is in a position of senior responsibility. To be a strategic nurse leader, I believe you need to have a sufficient education to give you confidence to lead, to enable you to interact with other strategic leaders of a similar education. You need to be politically astute. You need to be able to understand, interpret, and use data to influence discussions, whereas nursing in the past has often relied on their emotions. We certainly, as nurses, need to use an evidence base in our discussions and in our debates. But as strategic nurse leaders, we also have a responsibility to listen to others and know when to follow. We can't lead all of the time. We don't know everything, and therefore we have to listen to others who are more knowledgeable than ourselves in certain areas. So investing in the future leadership workforce, you're very aware that emerging nurse leaders learn by example, not just by formal programs, but they learn how to influence from us as educators and us as practitioners. They need to learn the use of digital technology to influence, and this in turn will assist them to engage in policy. At a post-qualifying level, we need to invest in advanced level of practice and the education of advanced practitioners so that they can lead locally, regionally and nationally. And as educators, we can help practitioners learn to lead through innovative strategies, not just in the formal programs, but through action learning sets, mentorship programs and coaching programs. You will be aware that 89% of the nursing workforce is female, but only 25% of senior roles in the healthcare organisations globally are held by nurses. So I'd like to take this brief opportunity to reflect on the past. When I trained to become a nurse, leadership, the word leadership, wasn't really talked about. There certainly was a hierarchy. We knew exactly who was boss in the system, and there was plenty of them. But traditionally, leadership was held by matrons and by ward sisters. In 1968, nursing students were required to live in nurses' accommodation. It wasn't permitted to live at home or elsewhere. We were required to undertake split shifts from 7:45 to 1 o'clock and then 4:30 to 9 o'clock. So only 3.5 hours break in the middle of the day, really with very little time to engage in anything meaningful. Some nurses had to attend classes after night duty, straight after night duty, or to work a late shift from 5 until 9. Our uniforms resembled 19th century domestic workforce or the religious life. And you can see here in the top photograph, this was me proudly presenting my newly qualified butterfly cap. And it was huge. It went out in a huge butterfly at the back. And then as a staff nurse, I had what we called pillowcases that we sat on our head that come out and went into a large flute at the back. Very difficult, both of those, to manage judiciously patient care in and out of curtains, screens. Nurses in 1968, I understand, were permitted to marry. They weren't permitted to marry before that. And I have a friend now who trained about 10 years ago, 10 years prior to me, at Edinburgh Royal Infirmary, and she won the Best Nursing Practitioner of the Year award as a student. Married straight after qualifying and was never permitted to work. Nurses worked and trained at the same time. Practice, when I was qualifying, was task orientated. So a pair of nurses would be engaged in making all the beds in the ward, or doing the backgrounds, rubbing patients' pressure areas, or bathing patients. So everything was revolved around the tasks. It wasn't considered emotionally favourable to get too close to your patients. And in fact, if you were seen talking to patients, you were very firmly encouraged to get on with the work. Then we moved from task orientation to team nursing and then primary nursing. And it wasn't really until primary nursing when nurses were encouraged to have some sort of autonomy in patient care, recognising their authority in looking after individual patients, that nurses really began to develop. Education at the time, from 1960 to 71, there was only one degree in Scotland at Edinburgh University that was a degree in social sciences with nursing, so not a dedicated nursing degree. And then in 1971, the first nursing degree, dedicated nursing degree, started in Manchester University in England. In 1986, nursing education moved wholesale into higher education with the diploma in nursing to qualify, and then in 2013 became an all-graduate intake. We began to think seriously then of education for nursing roles, so supporting advanced practitioners with master's degrees, not with specialist courses. And then as nurse consultants were introduced in 1999, they were required at the time to have a master's degree, and then more recently nurse consultants are looking to complete their doctoral qualification. Research, well, there wasn't any. Doreen Norton in her pressure area care was completed around this time, but it didn't really reach practice, or at least in my experience, it did not reach practice. The RCN, Royal College of Nursing, undertook some small-scale studies in the early 1970s, and then more widely research was undertaken in the 1980s. But don't forget, evidence-based medicine, the precursor of evidence-based practice, was only invented really in the early 90s at McMaster's University, and then it took some time to get across the Atlantic to the UK. So nurses' ability to lead really was predicated on their more advanced level education, a degree qualification, their research, the production of evidence, and they changed the organisational care. Investing then in the nursing workforce. The State of the World's Nursing identified that there are 6 million nurses short over the next 10 years. And even if we educated a further 4.7 million, we would only maintain the status quo. 80% of nurses are found in countries with 50% of the population. And this means that 20% of nurses are in countries with the other 50%. This report found that 1/6 of countries will have fewer nurses than those expected to retire over the next 10 years. So we very definitely need to invest in educating more nurses, improving their terms and conditions to attract them into nursing. We need to invest in improving the culture of nursing to encourage nurses to stay. And we need to provide and educate nurses for career progression and perhaps entrepreneurship. So there very definitely is a need for governments to strategically plan for this shortfall and in developing the global infrastructure to support them. And we need ethical recruitment so that the Western countries are not using unethical means to recruit nurses from developing countries or resource-poor countries who have insufficient nurses to support their own health systems. So, are we progressing? Well, the International Council of Nurses identified a very conservative estimate of 115,000 nurses dying during COVID. Nurses are burnt out, and their intention to leave have increased by 20 to 30%. On a positive note, there has been an overwhelming global response to the World Health Organization report in a positive way. However, since the publication of the report, there have been a number of global issues which have impacted the prioritization of investments, particularly in the pay and reward of nurses. We've had the pandemic, we're having the pandemic. There has been mass global unemployment as a result of the pandemic, and also as a result, global financial crises. There also have been a number of environmental disasters such as floods and fire. And of course in Europe we have the current war in Ukraine, which has resulted in a number of countries reprioritising their financial situation to invest more heavily in the military for defence. On a positive note, with the exception of Africa, countries have certainly increased their nursing recruitment, and long may this continue. What of the UK progress? They have certainly, the UK, increased government funding for health and care sectors. Is it enough? They have introduced student bursaries to attract students into nurse education to support them in their living expenses during training, during their education. Each of the 4 countries of the UK has awarded pay rises as a result of COVID-19. However, we have also had Brexit. This has impacted the free movement of European nurses to the UK, and we relied so heavily on European nurses in the past. The current government's manifesto was to increase international recruitment by 12,000 nurses and by 50,000 nurses by 2024-25. However, investment in nursing and nurses is complex and much more needs to be done. In conclusion, we found that investment in nursing and its leadership are essential to global health. Success, however, does depend on governments valuing nurses in their strategic planning to cope with shortfall, in treating nurses fairly and preparing them to lead. We also found that organisations health and care organisations are also responsible for compassionate, inclusive cultures in their organisation to encourage nurses to stay. However, nurses themselves need to invest in themselves, in their education, in role expansion, supporting the next generation of leaders, and be politically astute, learning how to use and use data to influence change. So, in summary, investment in nursing and its leadership is everybody's business. We need desperately to build resilient health systems through investing in nursing to prepare for the challenge ahead. Thank you. I just wonder if there are any questions. A few references, and that's my contact details if you want to use them. Thank you.